Yeah, I'm like, holy
Private
smokes.
message.
Here we go.
Welcome. We are so excited to welcome you to the Nurse Leader Listening Tour. We have such a great guest today, but before we start, we want to extend a warm welcome to the Think Differently by Design Listening Tour with your hosts, Dina Redinger and Sharon Weinstein, co-authors of the book, Think Differently, 18 Strategies to Fix Broken Thinking. We invite you to engage with your peers and us as we address those issues related to nurses, nursing, and the workforce that are so critical to our success. In our studies of women in leadership positions, we have found that success happens when we ask the right questions and solve the right problems. Today, within healthcare, there's no question that we do face some critical challenges and real problems. We invite you also to be a part of our discussion in a 30-minute interview if you'd like to do so and reach out to us to learn more. Our goal is to provide nurse leaders with an opportunity to be heard, to express their opinions, share ideas, and tell their stories. But before we start, we want to acknowledge you. We want to know where you're from, where you're tuning in from, and please share your comments in the chat. We'll be sure to comment back. Dina, over to you. Please introduce our guest.
Thank you, Sharon. That's a great introduction. And I wanted to introduce an amazing guest that we have today, Dr. Enoh Ukpong. Welcome, Enoh.
Thank you.
Let me give a little background about you. What's interesting is 58 years ago, you came into the United States. You came in with open-toed shoes and a dress in the middle of December in Worcester, Massachusetts, of all places. You took off and you created this amazing career. So let me give everybody just a little view of what you've done and where you've been. So you're advanced nursing coordinator and supervisor with St. Vincent's Hospital in Worcester. You have a PhD from MCPH, University of Worcester, Becker College for 21 years as a nurse professor and instructor. You're now a part-time professor at Anna Maria College in Paxton, Massachusetts. And she's an author of this amazing book, Joy Comes in the Morning, which I think is fantastic, by the way. So welcome, Dr. Enoh Ukpong.
And
Thank
if I
you.
might add, joy is right now while we interview you.
Yes.
This is the moment of joy.
Yes.
Go ahead, Ina.
Thank you so much for having me. What a wonderful introduction.
Thank you. We're excited to get your thoughts because all of this years of knowledge that you have, when you think about this, almost 6 decades, you've seen so much in your lifetime, and then you've come here to the United States and nurse, and we are dying to hear what you think about some questions that we have for you. So the first one is a very important one. What is driving nurses away from nursing? We hear they're dropping out by the millions. What is your thoughts?
What drives nurses away from nursing? The key reason is patient safety and nurses' safety. If I'm
Mm-hmm.
going to work and I can't give my patient my very best, that jeopardizes my license and sometimes my safety too. Because if I don't have adequate staffing, um, a violent patient can hurt me because I don't have somebody to help. So it's not worth it. As a nurse, it's very, very disheartening not to have sufficient staffing for me to do my job to my satisfaction and to my patient's satisfaction. If
Yeah.
my patient is not satisfied, I'm not going to be satisfied because I know that I haven't done my best.
Yeah, that's what I keep hearing from a lot of healthcare people right now is that they have a lot of nursing staff because of the staffing situation they have at all levels in the hospital. They find their nurses doing things other than their jobs, and finding a lot of frustration with that. So it kind of substantiates what you're saying is that really you want to give your patient your very best, but yet you're so taxed with so many other things besides nursing that seems to be driving nurses away. Did I get that right?
Yes.
Excellent. Back to you, Sharon.
So we're driving nurses away. We know that it's a huge issue. We also know that you've been in nursing for a long time. You've had a profound career that has taken you from the bedside to the classroom. So in process and practice academia, you've basically done it all. And you, like me, have seen cyclical changes in terms of nurses. We have a surplus, we have a shortage. Although truly, between the two of us and our listeners, we have more shortages than we ever experienced surpluses. There have been times when we have brought nurses in from the outside, when we have done all kinds of things to fill the masses and to fill those slots and to take care of people. I know that you said that safety is a big issue. Is safety an issue because we're working such long shifts and nurses just don't have the time to regroup, to focus, and they worry about being understaffed and the inability to provide the quality that they want to provide? Is that the biggest issue, timing?
Timing, yes. There was a time that we used to do team nursing. In team nursing, you have one nurse that passes med for that unit. The other nurse will do treatment, that is wound care. The other nurse will do. That was how it was then. We work as a team. But as time changes, things changes. We are now doing primary nursing. With primary nursing, each unit is staffed according to the acuity of the patient on the unit. Acuity means how sick the patients are. Patients with higher acuity numbers means they need more care. So with that, the current nurses have something to go by, because if my unit, I'm supposed to have 5 nurses today, for any reason they gave me 4 or 3, I have got to show that we are not adequately staffed. And for that reason, there was a time you will never hear of nurses going on strike. Nurses never joined the union because we were considered like charitable organization. How can you walk away from your sick patient? We didn't do that. But because of how things have changed and how a lot of companies want to make more money while the nurses suffer, for that reason, not too many hospitals are not unionized today. Many hospitals are unionized. And if the upper management don't cave into the nurses' demand, which is mostly patient safety and nurses' safety, then you see them out on strike. The most important reason why nurses walk out on strike is patient ratio, long hours of working, and pay.
We know that acuity levels are higher than they have ever been.
Mm-hmm.
Those patients who you and I used to see when we had 40 patients on a unit with an aide or an orderly are now being treated at home or as outpatients. The people who are in the hospital have bells and whistles attached to them and are, in fact, very ill, requiring high levels of care.
Yep.
Lots of monitoring, lots of things going on. This increases the stress level and doesn't really allow for a nurse, especially a nurse who's in the sandwich generation, caught between perhaps elderly parents and young kids at home, or even teenagers, to be able to really focus, to give their all. By the time you take a 12-hour shift and attach travel time to it, and then downtime, refocusing on what it is you have to do besides your job, you're just drained, you're strained, you're emotionally and spiritually empty. How do we fix that?
We fix that by upper management listening to nurses and providing what the nurses need to take good care of their patient. For me, taking good care of my patient is taking good care of me, because when I give my patient good care, it makes me feel good. I mean, I will walk away so down if I could not give my best, especially when the patients are that sick.
Right.
So upper management needs to listen. And lately they have started mandatory 12-hour shifts, which for me, right now I can do that, but there was a time in my life I will walk away without a second thought. When my kids were little, job was secondary. My kids were first. There's no way I would have done a 12-hour shift then. I had always loved nursing because of the different hours, different shifts.
Flexibility, right?
Flexibility so that you can fit your life into it. But now they're almost like that is gone. You have to do it my way, when and how. And that makes no sense to walk away.
I think that what we've always wanted is not to fit our life into it, but to fit it into our lives. So that our lives come first. We have responsibilities.
This is what they have to understand. Work is not all that I am. So that when it is time for me to devote to work, I do devote that to work. When it is time for me to devote it for the rest of my life, leave me alone. Let me do that.
You know, you said something really important, and I think it's been a shift, right? Through the pandemic, there's been a lot of stress on the systems, a lot of stress on staff, nursing, anything in healthcare, and we're kind of past that pandemic time. We're not over it, but we still have that antiquated old leadership, top-down leadership that really is still not working. And what I hear you both say, Sharon and Enoh, is that leadership has to get it right. It's a bottom-up approach. If you don't understand what your people need from you as a leader to make life work for them, it's hard to give your patients the best. So with that, you know, what is leadership need to do to fix this problem?
Leadership needs to listen. Not only listening, to take the nurse's complaint into consideration and do something about it. I don't mind working short 1-2 days here and there, but when it becomes a permanent thing, I'm going to react. Recently, what I have picked up is they're actually letting go the respiratory therapist, the IV nurses, and leaving all that responsibilities on the nurses, additional responsibilities. The nurses are fighting with that. I don't know how far they are going to get with that.
Yes.
I feel for them. Can you imagine a nurse that is not comfortable inserting an IV, and she is killing the patient by poking the patient everywhere looking for vein, whereas an IV nurse probably could have gotten that line once like this.
Right. As one who practiced infusion for 35 years, I'm already feeling it. It hurts. I remember, though, Enoh, several years ago, there was a nursing shortage, and there was also a strike in New York. And during the strike in New York, residents, interns, and house staff took the place of nurses in New York City hospitals. They had no clue as to what they were doing.
That's amazing.
They just were overwhelmed.
How long did that last, Sharon? How long did that last before they're like, oh, this isn't working?
Not a long time, as I recall. It was just that's not feasible.
Right.
You can't take people who just don't have that education and training, the assessment skills, the nursing process, and put them in a situation. Don't forget, Enoh, it's nurses who teach doctors how to do IVs, who teach doctors how to do certain things. So how can you possibly ask them to fill in for you and to do the physical care as well?
Right. Yes. So I'm going to ask you another question here. So what would you say to a nurse who is frustrated? You know, she's feeling like, you know, I think I'm just done. I need to get something different because this is just not, you know, it's killing me, for one. What would you say to those nurses who really love what they're doing and are considering leaving? What would you say to them?
I am looking for the highest mountain to shout about the nursing profession. The nursing profession is so broad. What I said to my students is, when you graduate, first and foremost, just kind of fool around to look for your niche. There's so many areas. If you don't like it here, if they don't treat you well here, go on to another place. But before you do that, immediately you have your license, kind of float around to have an idea of what different areas of nursing are. What we do before you get your bachelor's or your associate is to touch every area of nursing in nursing schools. That is not enough. when you finish, for me, I started in a float pool so that I went around each areas to make out what area that I really like. So because there's so many areas, if I give me a headache here, switch. I am looking forward to when nurses will be going to the moon to take care of the astronauts.
I love it.
When I tell my students that, they look at me like, what? I said, it's coming.
Yeah, they all want to sign up for that job.
Are you kidding me? I'll sign up for that too.
Yeah, that would be a fun job. It's kind of interesting that you bring that up because the opportunity to float from one area to another is not always available to people in other sorts of professions. Nursing is the most honorable, the most trusted profession.
Yep.
We do have a wide range of opportunities available to us. And you're exactly right. If one part doesn't fit well, there are other options. There are options that can fit in with our lives and with our other interests. The challenge is that in hospital nursing, hospitals are open 365 days a year, 24/7. Somebody needs to be there. And yes, if leaders listen to nurses, what if they listen but they don't implement? What if they're not willing to listen to the nurse and then say, what a great idea. Would you present that to the Shared Governance Council? Would you speak to other people about that so that we're all on the same page?
I will. There is no point of listening if you're not going to do something about it. I'd rather not even see you.
Right. It's just lip service, isn't it? It's nothing.
Oh, that will just infuriate me. You listen to take action.
So it's almost what I hear you say too, which is probably the opening statement for every nurse in America is, I want to share with you something that is important to me, but if you're not going to take any action, then we should just walk away. There's no use to me sharing that.
Yep. Because you must have tried, and if they have done nothing about it, move on.
So it's a commitment. What I hear is a commitment. And it sounds like there's got to be a commitment from both from a leadership perspective and also a nursing perspective too, because you've got to have the confidence to step up and ask for what you want. And there's a lot of women out there who don't believe that there can be any action on the other side, if they step up and ask for what they want. And I think that's kind of what's caused some of the striking that's going on, because there's confidence in numbers, right? But if leadership can take time to give people a chance to share what they need and what they want, would be critical.
I have worked in places that the nurses went on strike. They had tried before they went on strike. They didn't just start with a strike.
Yeah. Yeah. So what kept them in the game? What happened that the strike was very shortened? Give me a little bit more context around what happened.
The first strike I encountered didn't last for that long. We had to hire travelers to fill in the positions of the nurses that were on strike. It's so funny. I'm driving into work. I will stop, hug my nurses that were outside. Those that were outside were my nurses. Those that were inside were my nurses. So I had to embrace both of them. I did. I thought the people inside or outside would hurt me for that, but they didn't. I was just being honest with myself. And in the end, they have to come to a compromise. The last strike that had just happened here, I was walking through the school, took my students for clinical there. When the strike started, I couldn't cross the picket line with the students. So I was sent to a different hospital to do clinical with those students.
How do nurses being on strike, how does that impact the clinical rotations of your students?
I was not allowed, immediately the strike, we stopped going.
So then they're using simulation rather than real patients?
It's so funny because it was during the pandemic.
Oh.
So I was doing the clinical online. Yep. We have Fifth River online.
Oh.
And then when the pandemic lessened up and we opened, I still couldn't cross the picket line because the strike was still going on. In fact, this last semester is the first time I had been assigned to that hospital.
Wow.
What happens, when you graduate nurses who graduate with a BSN and they pass the state board, but they have never touched a patient because of COVID or because of a lack of clinical rotations?
We were lucky we didn't have any of such. It was like in between 2020, 2021 with the COVID. Other than that, so some of them had some clinical at the beginning and some had at the end. We never had students that never had real clinical on clinical side.
Right.
Mm-mm. We were very lucky. We didn't.
Interesting.
That would be terrible because it doesn't matter how good the lab is. It doesn't matter how online it is. When it
That's
comes
right.
to nursing, you need your hands on. You need the interaction with the patient.
That's right.
Mhm.
How do you judge skin turgor and other things when you're not physically able to have that hands-on, that human touch?
Even the interaction with the patient. Patients are humans, they are individuals.
Right.
Mhm.
Yeah. Powerful. Powerful.
Wow.
Well, I wanted to kind of circle back around and kind of wrap up this time with us together. I think I've heard a couple really important things. Number one, nurses need flexibility. If they don't have that flexibility, then they really are going to, we're going to find more and more nurses dropping out. We need people in leadership roles to be able to give nurses time to be able to share what they need and what they want. And also, I think it's really important that, for nurses, they can't give their best unless they are also treated the best.
Yep.
Is what I took away from this whole time with you. What else did I miss? Or you or Sharon, you want to jump in and tie this up for us?
I think that if we want to have a focus on life work integration, and we do, and we want to promote the concept of self-care, we need to give nurses the opportunity for self-care. We need to respect the fact that they too are human beings with lives and that they have their own needs. And we need to value that as much as we value having them at the bedside or in the clinical area. What do you think?
That is so correct. That is so correct. And for you to have happy nurses, you need to give them adequate staffing. You need to be flexible in the hours they work. And you also need to pay them well. Good
Yep.
pay. Mhm.
Pay them well. Pay them well and treat them well.
Exactly. Thank you.
Yes, because you can pay somebody, but if you don't treat them well and listen to what their needs or their
All
wants,
the money in the world is not going to matter.
to keep them.
It won't make it better because they might still be understaffed and overworked and overwhelmed.
Yes, yes. Well, I just enjoy having you on with us today, Sharon and I, on this listening tour that we have for nurses, and we think you have an amazing, gift that you've given the world of nursing over these last 6 decades, and certainly want to thank you for being a part of that. And I'll let Sharon kind of close us out.
Okay, thanks again, Enoh. That was wonderful. You've left us with so many important talking points, and I know that there will be lots of comments about this session. But for now, it's time for a close and an invitation to join us next week on Tuesday, this week on Thursday, sorry about that, and next week on Tuesday and Thursday, again at 12 noon Central Time, as we present another outstanding nursing leader to address the concept of listening first. We want to put the health back into healthcare. We need your help, all of our help collectively to make that happen. So thanks for being with us today. We appreciate it.
Thank you all.
Thank you so much
Take
for
care.
having me. Happy
Thank
New
you.
Year. Happy
And to
New
you.
Year.
And to you.